Have you gotten your flu or COVID vaccine this year? If not, you are not alone.
Doctors are sounding the alarm because low vaccination rates are leading to a rise in flu and COVID-19 cases. And joining us to continue the conversation is Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Doctor, nice to have you with us on this Wednesday morning.
Thanks for having me.
So who is considered to be at high risk for more serious illness or hospitalization from flu or COVID-19 at the moment?
It's actually a large swath of the population. So it's anybody that's very young, very old, anybody that's obese, anybody with any underlying condition or like heart or lung disease or diabetes, the immunocompromised, and the pregnant. So it's a large group of the population.
Doctor, how do antiviral treatments work in combating some of these, and who are they recommended for?
So antivirals are recommended for high-risk individuals primarily. And how they work is that they interfere with the virus's ability to sort of take the steps necessary to make copies of itself, to make high levels of the virus in your blood or in your body. And antivirals bring the level of virus down in your body, which then decreases the chances that you have a complicated case. So they're basically pills that you take that interfere with the virus and get you better faster sometimes, and also prevent complications from occurring.
In your opinion, doctor, are these medications being prescribed as often as they could be or should be?
No, they're definitely underutilized. Not many people who are eligible for them get them. People don't know about them. And that includes, even providers who aren't aware that their patient might benefit. So this is a major problem because these are great tools, but they don't help anybody when they sit on shelves.
It's interesting. You said that sometimes people might be ineligible or they might not know about them, or it's the healthcare provider. What do you think might be keeping doctors and other healthcare professionals from prescribing antivirals to patients for those who are aware of them?
It's complicated. I think there are many different factors, but one is that providers don't recognize that antivirals, aren't just a little bit extra. They actually are game changing. They can prevent you from needing hospitalization. Some of the COVID antivirals prevent you from dying. And I think that's just not well conceptualized by many providers. And they think maybe that the patient is ineligible, maybe it's been too long, or maybe they, paradoxically, they look too good to need an antiviral, even though they might have a high risk condition, or they might say, oh, this is just not something that's going to be that useful. And I think we've got to dispel that. I think that's a lot on us in the medical field to talk to primary care providers about the benefits of antivirals, but it's also something that the public can be empowered about, to kind of prompt their doctors to do that, take that extra step and think about an antiviral. So that's one part of this, is making sure that the public knows that there are antivirals, and maybe I should ask my provider, do I qualify for an antiviral? Will it help me?
That was going to lead into my next question for you, doctor, is, for the patient who might be hearing about some of these antiviral treatments that are out there to address some of these respiratory illnesses, is it on the patient to say, hey, doc, I've been hearing about these treatments, tell me about them, or should they be doing their own research on what some of those treatment options are? And if so, where is a good place for them to go to ask or look into those?
These are prescription drugs, so patients are not going to be able to take this without a doctor's prescription or a provider's prescription. So they will need that input. But it is important for the public to be educated, to look, for example, at the CDC website, cdc.gov, on the antiviral section, and familiarize themselves about what these antivirals are, who they benefit, when to take them. That, an empowered or an educated patient is an ally for a provider. So I think that while providers need to do their job, I think having an educated public that knows about this stuff and prompts these questions to arise in the provider's mind is a good thing.
And doctor, you mentioned, or we mentioned before, that vaccination rates have been low during this season. In your opinion, why do you think that is? And on the other side of things, what is your message to people who are not vaccinated?
Vaccination rates have fallen after COVID-19. COVID-19 was a time when the anti-vaccine movement basically energized itself. They're on steroids. Their leading proponent is sitting in Washington right now in a confirmation hearing. So anti-vaccine sentiment ran very high and bled from the COVID-19 vaccine to influenza vaccines, to childhood vaccines, even to vaccines for pets. Those are also down. So we have a real battle when it comes to convincing people about the benefits of vaccines. And that's what I would tell people. Our vaccines are probably humankind's greatest technological invention ever. They have added decades to every person's life. They've saved hundreds of millions of lives. And it's something, I think it's sort of the voice of the dark ages that's trying to attack vaccines. And I think these need to be defended. And it's going to be a long haul to get vaccine rates where they need to be.
Do you think it's the anti-vaccine movement, or is part of this just the fact that we aren't seeing a huge number of cases like we were during the crux of the pandemic? So people are thinking, it's not a big problem. Maybe I don't need one this year, and I'm not going to get it.
There's always complacency. There's this idea that when diseases get low, the people think that they don't need the vaccine. So when measles cases are very low, they don't think the measles vaccine is valuable. Or when polio cases are low, you don't need those things. But they don't recognize that vaccines are that barrier that keep these viruses, keep these infections at bay, and that we can't relent. Or we go back to the bad old days when you had cases of measles, when you had cases of polio. And I think that we live in a society where we have the luxury to not think about them. But you have to think, measles kills tens of thousands of people every year. And polio still paralyzes people. So it's something that you have to constantly remind people that that vigilance is necessary, and that these vaccines are only good when they turn into vaccinations into people's arms.
All right, Doctor, thank you so much for your time today here on ARC Seattle.
Thanks for having me.
We've reported on, for weeks about